Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 weekly update for the week ending December 9th, 2021. This week, I'm going to cover two questions. That is, what is happening with the current surge? And I'll say a few words about the Omicron variant. And then I'll share my personal advice on preparing for the holidays. So in terms of what's happening with the current surge, we've been watching with some concern the uptick in numbers of cases, deaths, and hospitalizations. Globally, we're seeing a pretty strong spike in cases, as you can see here. The deaths have been creeping up slowly, but not nearly as steeply, but still at a very high level and much higher than it has been, except during the three previous peaks. About 5.3 million deaths to date, and we're still running about 7,000 deaths a day worldwide. So still a very significant problem. In the United States, we're seeing this upsurge in cases. There was a little drop there, but you can sort of see this trend going up. We're beginning perhaps to see the same thing with deaths. It's a little early to say. Over 800,000 deaths in the United States to date and about 1,000 deaths a day. The marker that we've been looking at, of course, also is hospitalizations, and you can see that it's creeping back up again, though still well below where it was in the two previous peaks. But the uptake is always a worrisome thing for us. The state of Tennessee, we're seeing a slow increase in cases and this rather odd jump in deaths. We'll have to watch that. Sometimes with small numbers, these go up and down. To date, over 17,600 deaths in our state, and we're running about 50 to 100 deaths a day. It's a little hard to say because this number is jumped up so quickly. In terms of hospitalizations, this is a little misleading because it only starts at the last peak, but you can see that from the low point a few months ago, it has been creeping up pretty steadily. If you look at our region, again, you see this much quicker spike back up, about 10 times now more people in the hospital than we had at the lowest point here, but only about half as many as we had up here. So we'll keep an eye on this. Whether it's slowing down here or not, it's hard to say. In terms of what we know about who's being hospitalized, 90.4% are not fully vaccinated, but 100% of the people in the ICU are not fully vaccinated, and 100% of the people who are intubated are not fully vaccinated. To give you some context for this, if you do a weighted balance of the 20 counties in our region, the vaccination rate is pretty embarrassingly low at 51.8. But what that means is that we have about a five-fold decrease in the risk of hospitalizations. And of course, at this point, both for ICU and for intubation, the vaccination appears to be fully effective. Obviously, these numbers will change in time, but the data are very, very strong that vaccination reduces serious illness and death related to COVID. In terms of the Omicron variant, there's not a great deal of new information. Last week, I went to some depth about what we know about it. It's now reported to be in at least 57 countries and at least 19 states here in the United States. What I said last week appears to still be true, which is that it is probably more transmissible, easier to spread, but there really is yet no definitive information about its severity of the disease or lethality. So in terms of the surge, yes, we are seeing a surge. Appears, we just simply can't predict what it's going to be like, but we're seeing an uptick in cases, deaths, and hospitalizations in all the locations for which we have data. In terms of my personal advice for preparing for the holidays, I want to stress this is my advice for personal events. I'm not giving advice to corporate, business, academic, faith-based institutions or anywhere else. As you all know, there are mandates and injunctions against mandates, and I am not about to get involved in that because I simply don't understand it. But for people, families that are thinking about getting together for the holidays, I think there are 6 levels of intervention you can choose from, right? At the most extreme, you can say, hey, I'm going to have no face-to-face events at all. Or you can assure that everyone's vaccinated. You can ask folks to get a test 24 to 72 hours before gathering. You can wear masks. You can minimize contact, especially at large events, or you can carry on as usual. And you can sort of get a sense here that the lower numbers here are the more aggressive interventions, if you will, and the higher numbers are less aggressive. But given that those are your choices, how do you make a decision? And let's start with an understanding that there is a value to holiday traditions. It's valuable for children to get a chance to see relatives that they don't see otherwise. It's valuable for folks to go through lifelong traditions with a range of generations. So let's start with the idea that there are value to holiday traditions. How do you decide which interventions to apply? Well, I always think the best way to do that is to start by asking, is there anyone who is at particularly high risk? Obviously, folks who aren't vaccinated, who cannot be vaccinated, are at high risk. Older folks continue to be the highest risk group. Those with chronic conditions, heart and lung, weakened immune system, obesity, diabetes, cancer, liver and kidney disease, or otherwise advised by a healthcare advisor. Women who are pregnant or recently pregnant, those in congregate living facilities, those whose job could put others at risk, and anyone who has an upcoming event or activity, whether it's a marriage or an Olympic competition for which medical disruption would be problematic. The more folks, or if you have folks at high risk, obviously you want to err on the side of being more aggressive, right? Maybe not having events at all, or making sure that folks are vaccinated and tested and so on. So you start by asking, is anyone at particularly high risk? And then this is the more difficult question. What is your personal comfort with risk? Remember, there is nothing we can do that is perfectly safe. Even people who are vaccinated and who have tested negative could potentially have or spread SARS-CoV-2, the virus that causes COVID-19. But obviously, the more you do, the safer you can be, and therefore you can have a comfort with risk, right? And then, it's also helpful to know what your guests are. You don't want to invite people to your home and then discover that they are either not willing to do anything or wish that you do more than you're comfortable doing, right? So then you make the best decision that you can. Ask folks to show that they're attest that they're vaccinated. I'm going to have folks, be tested negative or whatever. So you're balancing the importance of the holiday traditions with the need to be safe, and then explain calmly why you made your decision. And understand that for this holiday season, at least, there will be some people who cannot be a part of your event. Either folks who are in such high risk categories that they would be putting themselves at risk, or some people who are simply unwilling to go along with your recommendations that they be vaccinated or tested or whatever it is. But even for these folks, do your best to include them from afar by phone, video, or other mechanism. COVID-19 may interfere with our holiday plans, but it should not interfere with our love for family and friends. So there is a surge going on. We don't know right now how serious it's going to be. Right now, it is a Delta variant surge, but there is Omicron variant on the horizon. We don't know what's going to happen with that. And my personal advice for the holiday is understand that you have some control of the risk and that you have to balance the value of the holiday traditions with the risk. Great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please let us know. Contact Jan Stork at that email address. Thanks to Dara Young for editing, producing, and posting this video. And as always, if you have any questions about what I've said today or any questions generally about COVID-19, please let me know. I'll do my best to address your questions. Until next week, be well. And if I don't see you before the holidays, have a happy holiday season.